growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, it's Dr. Steve Rasner. Welcome back to The Lionhearted Dentist. Those of you that have been emailing me, I thank you. It makes me feel connected to you guys. It makes me aware that this is indeed worth it. So I appreciate those emails. Keep them coming. If for some reason I don't get back to you, please don't hesitate to say, hey, I know, whatever you want to say. Do you have a second to answer me? Because sometimes I just can't find my keys, if you know what I mean. That email is drrasner, R-A-S-N-E-R, at AOL.com. Last week, I told you I was going to break off from the weekly Corona update of what you should be doing to survive your practice. And I really felt it was time for us, for everybody listening, to get back to training. I use the expression, it's time to get back in the gym. It's time to go back and do what you need to do and not put off another day, month, or year postponing the action that's required to get you to the practice of your dreams, which is sitting right in front of you. I don't care where you're located. Look up where I'm located. Please do it. And Google. I'm in Vineland, New Jersey. And I also have an office in Bridgeton, New Jersey. And I'm not bad-mouthing those towns. They have been very, very good to me. But they're not stable economic areas of the United States. And even in that area, we've been able to achieve some serious gold standards for what a lot of us would like to have in a practice. And that's what these podcasts are about. I want you to have that. Do you understand? Let's just be clear if this is the first time you tuned in. I have an institute called the Rasner Institute. Yes, on occasion you'll hear me talk about the courses there, but that's, I don't send you, I have books and tapes and all these kind of things. I can't remember the last time I did any solicitation, and I mean like years, to actually sell books or tapes or things I spent a lot of years creating. It's not what these podcasts are about. And for whatever reason, 2 years ago, I decided, I wanted to reach out to you guys and tell you how one colleague's approach to, pardon the expression, killing it in his profession, what his approach was. And that's what I've been sharing with you now almost 2 years. And, we got hit by a tsunami of bad fortune with Corona. Something obviously no one else ever anticipated. And it had major destruction for us. And I spent many, many podcasts before I went back to work and in the early weeks I went back, telling you what to expect if you hadn't gone back, so it would help you a little bit. You can reach out to me. I'm more than thrilled to tell you what I'm doing in a given situation. But I had this epiphany in the last couple of weeks. So you know what? It's time. It's time to get back. It's time to do what you need to do to achieve this practice of your dreams, which is very doable. So that's what we're going to be going for the next several podcasts. And in the last podcast, I asked you to consider what it is you're looking for. Like, what is your dream? I can only give you what's worked for me and many of my colleagues that have followed me. And I think, the classic practice that offers services embedded in basic, healthy, restorative dentistry, and perio. And if you took that to the nth degree, you would be what's called a perioprostodontist, of which I am not. I don't pretend to be. I didn't train for that formally. But, we live in an amazing time, you and I, where there is abundant sources for you. I mean, unbelievable continuums to literally resculpture your skill sets. No matter where you were, no matter in your class rank, no matter how you were invested or not invested as you went through dental school, you can change all that. It's right in front of you. And I got to tell you, I've never said this before, but even if money was tight, if there's one thing I would not tell you to borrow above your means to buy a house or a car. If I had it to do over, I would jump in to CE, the kind of CE that counts, live CE, if you want palpable change. And I would even borrow to make that happen. That's my opinion. Some of these continuums, I'm sure, can be quite expensive. I'm telling you, it is your ticket to a place in dentistry that many of your colleagues will never know. They won't. They'll never make that investment. They wouldn't even dream of spending $12,000 or $20,000 or what it costs sometimes to take a year-long continuum. And so I am telling you, that's your ticket. So what would I take first? And just for the record, I did redo my recommended residency during the Corona break for the first time in probably 8 years. So part of what I used to recommend probably was somewhat dated, but you can write to me for that and I'll send you, it's a 2-page outline on what I would take and when, where, and at what pace, like what would I take first and second. And I just want to tell you, the first thing I would do, so here we are, we're back telling you how to get the practice of your dreams, whether, I don't even want to put a dollar figure on it because it's really not a dollar figure. Like, you know, it's well known that I have this multi-million-dollar productive practice. Probably a lot of guys do. You know, are you working like a rat? Are you proud at your recall visits? Are your patients fond of you, or they look at you like you slammed something down their throat that they weren't sure they wanted? That is not the Lionhearted dentist. The Lionhearted dentist walks into his office on Monday and has a room full 99% of the time, you'll never please everyone, of appreciative patients that maybe they don't get everything you're doing, but they know that you have very high standards. They know you're not just about the dollar. They know that you're really invested in clinical excellence at whatever level they can appreciate that. That's the Lionhearted. And a lot of you have taken Lionhearted to degrees beyond me with your personal fulfillment of your personal lives. You know, so whatever that is, the first way to get there, but I'm going to just give you the framework in this podcast, and that would be to get your oral sedation permit. So I've gone on record many times talking about the benefits of a sedation practice. And I'm going to tell you something I don't believe I've ever said. I've been teaching the advantages of the sedation practice for 20 years. I don't know why more of you don't do it. So I have a specific cocktail that was taught to me 20 some years ago that is different than the docs. And I'm not degrading the DOCS organization that teaches in many states, very well done, their sedation. I just don't use their protocol. If you need to take their training to get your permit, then do it and just use whatever protocol works best for you. But the cocktail that I've used, which again, please ask me, it's probably the number one thing I've sent in my last 20 some years as an educator to people that have seen me speak. By far, it's the number one request I get. And it's amazing. It's truly amazing. The first thing I would tell you to get is a permit. Why more of you don't do it, I just really don't know. I mean, it's kind of good for us, those of us that have the permit, that you don't. Like I have to go every 2 years in New Jersey to get it recertified. So you have to take 24 credits every 2 years. And it's literally almost the exact same group of people at the course to get recertification, which is a joke. It's easy. Why you don't do it? Maybe you're scared of the unknown. Like maybe you'll think something will happen to the patients that you sedate under the recommended medications I tell you to use. So just for that, I'm going to say to you, I've done it 24 years. I have never had one incident, not one. I should preface that and tell you that you got to follow the protocols. And I've rarely had to change my protocols. One of them is I never give nitrous more than 50%. So that's something that's worth remembering. And all you got to do is ask me, and I'll gladly send it out next week. And you'll have the protocol, and you should look at it. But there's not even a second skill that you could acquire that's even close to impacting your practice. It's just amazing to me that, even in my own area, you would think some dentists would have heard that I advocate this by now. I certainly market it. We don't charge for our sedation. The 3 medications we use cost collectively $8. And of course, there's nitrous oxide, which is certainly not free. But for me, the kind of quality of patients that I attract by that being a focus of my marketing, no cost sedation. But it's not even about no cost sedation. It's really about that we sedate patients and I have a permit to do it. Brings me in just endless stream of patients that are pretty high quality and just have bad experiences. It's every week of my practice. So I can't in good conscience give you advice on how to build the practice of your dreams without starting with that. It is the easiest of the things I'm going to advocate for you. It literally is. It's not advanced life support skills you're getting when in your training. It's not that. And I know many of you listening have IV training, which is tremendous if you have that. We did IV for many years, and I have to make it clear that my protocol does not work for 100% of the patients. There's a patient I'm working on right now that just crossed the line. I should have seen it, and I didn't see it. And now I'm in the case. I'm too far in it to say, well, maybe I'm not, but we'll see how it behaves next visit. But there's some patients that should be IV sedated, and it doesn't happen often to me. When I say that to you, it's 1 every 5 years that I wish I did not offered enteral sedation to treat the patient. So this patient came to me, 26 years old, never had, this is a tip-off right here, never had anything but IV sedation. And, he was cordial enough, and his mother was in the room. You need a patient that wants it to work. That's one of the keys you'll have to learn. You're not even going to have to even have this thought for 90+% of the patients you treat. But once in a while, you're going to get what we call borderline patients. Should you treat them or should they have IV sedation? And, I ask those questions. Do you want this to work with me? Are you going to work with me? Because if you fight me, you'll win. If you fight the sedation, and look, let me tell you something. I never knew this for years, but the sedation's kind of like drinking. It can bring out bad stuff in people if it's inside of them, and they can become belligerent and nasty. And that's what I have with this one patient I'm referring to right now. And it's torture when you're in it. I guess I could take a stand and, I'm already in. I've prepped 8 teeth at this point. I've temporized. I've taken impressions. I tell you, if I had charged him, double, it wouldn't have been enough. There's no fee I could give you for what it takes out of me when I'm working. But that is not almost ever going to happen to you. What's going to happen is you're going to look at patients that are softly snoring, that if you tap them on the shoulder, they'll open their eyes, that appreciate, that open up, that you put a bite block on and you don't fight it, and maybe you have a little laryngospasm once in a while, and you suction a little extra. And it is so amazing that I never get over how amazing it is. If you're not doing this in private practice, or even if you work for an associate, it is the number one skill that'll set up your practice for future years, without a doubt. And why more of you don't do it, I just don't get it. I don't. You should do it. So that's the number one thing I would do. And that really just takes a matter of 4 or 5 courses, certainly no more than a half a year, probably in your state. There's different levels of sedation. I believe this falls, the one I advocate, falls under moderate sedation. And you can't just do it. You have to do things legally. But once you get it, you can institute all kinds of savvy marketing that let your community know that you do this. So that's my recommendation for starters. What would I do after that? And again, I said, I believe it was early in this podcast, I would borrow to speed up my timeline. I would. If it meant that I could take more courses rather than stretch it out over several years, and not for the getting your oral sedation permit. That's not going to be an expensive proposition to you. I'm going to surprise you. One of the first Crown and Bridge courses I'm going to tell you to take, and he doesn't even know I'm saying this, would be Bill Strupp and Mike Blum in Clearwater, Florida. They give a 2-day course twice a year. It is the first course I ever took from a doctor that covered so many things that I could use on Monday and made me instantly a better dentist from core build-up technique. So Bill, just not to ruin the experience that you're going to have, of course, but one of the myriad of things he talks about is materials and what does he use, and he gives you cookbook. Number 1, do this. Number 2, do that. He's very, very thorough and knows his stuff. You'll be shocked at the teeth that he builds up and Mike builds up using their protocol they call it the core buildup protocol. And, it's very rigid. You can't have blood in the arena. You can't have saliva. But you can build up without post and without pins shockingly stable teeth to re-prep ideally now. And he does that on all his teeth. That's just one of probably 100 things he'll go over. And again, he doesn't even know I'm saying this because that's not why I give you guys mention of courses. I mentioned to you what I think will help you the most. So it would be your oral sedation permit. It would be Strupp and Brum. I think they give the courses in March and June. Clearwater, Florida, look it up. I certainly have no connection anymore to the Spear Institute in Phoenix, but I don't know of a better thorough, comprehensive arena for you to improve your skills. When I went through Frank Spear and John Coy's, it was in the 90s, and some after that as well, but there was a curriculum of courses to take. You didn't have to take them all in order, and they cover everything from occlusion to materials to the facially generated treatment plan. I don't know how you can become really confident if you don't know these things. And so that's going to be on my list. Now that's a name, the Spear Institute, that may take you 8 years to get through. You're not going to do all that in 2 years, I don't think. I would go out there 2 to 3 times a year. I went out to Seattle, I believe it was a total of 18 or 19 times in my career to train, just for that. At some point, you're going to need, early on, some foundation and inclusion. And I still believe the Dawson Institute, or certainly Pankey, I don't want to get you in too much to one continuum so you can't take a myriad of other courses. I'd rather you take Strupp and Blum, which is 2 days, and pick out courses, if that's allowable, at different levels over several years out of Dawson and Spear. And I have many others to share with you, but that's all I want to talk to you about today. And if you want specifics, then indeed I'm going to ask you to write to me, and I'll tell you, what's best for you. I hope you understand that I don't talk to you about upping your surgical skills for my benefit because I have 6 courses a year on surgical skills. It makes no difference in my lifetime, I don't know how to say this, if that course, which is sold out anyway, each time. I say it to you with earnest because it's true. Here's the thing. If you do the very first thing I said, which is get your sedation permit, you're going to attract patients that need teeth to be removed. Okay? And I'm not talking wisdom teeth. I refer out my wisdom teeth. It's just not enough ROI to me, which is return on investment. It's just not. So I'm glad I'm saying this to you, because I hope we're connecting right now and you understand, those of you that are newer to me, why I would say such a thing. Why would I advocate that you can take out every single other tooth? Root tips broken with 4 millimeters left. The surgical skills I can teach you to deal with that, a sinus perf, all the different suturing techniques that are required. And I wouldn't tell you to skip taking wisdom teeth out, because I think there's a very increased chance, due to geography of the mouth and anatomy, between tooth number 17 and 18, or 31 and 32. And can you get in trouble treating 2 through 31, or number 2 through 15 on the maxilla? Of course you can. But there's undeniably more potential for post-surgical morbidity and negative consequences. And it's not like you get paid so much more to do those teeth. And this is from somebody that does an enormous amount of surgery. So that's why you hear me tell it the way it is, if you will. Okay? So I'm going to also tell you, so what I would do is I would take a piece of paper. This is what I used to do. And I'd write down what I'm telling you, or have me send to you the recommendations I'm talking about, and put it on a piece of paper, pull out a calendar of the next 2 years, and start mapping out the clinical plan that goes very, very much with your plan to achieve the dream practice. This is how you do it. It's how I did it. I would pull out a 2021 and a 2022 calendar. I would. Now, some of these guys may not be planning courses yet in 2022, but certainly they are in 2021. So if you have to do it 1 year at a time, then that's what you're going to do. I would take a triad, like certain courses that aren't really that connected to the others, like your oral sedation permit courses, like an occlusion course. A third course would be maybe an introduction at the Spear Institute, without getting into one every 3 months. You can now tell why this is going to take several years. And if you can, whether it's me or you can find somebody closer to you, you need a live atraumatic extraction course where you can go and exercise live skills, meaning you do the work. I have that arrangement in the state of New Jersey, no matter where you're located in the United States. But there could be others. And if there's others, then take them if it's more convenient to you. I just want you to get the skills. And those skills are taking teeth out atraumatically, which means you can get almost any tooth out in 15 minutes tops. And most of the time, much, much quicker. And you know how and what to graft what materials with, because we're always going to graft today when we take teeth out with the assumption that there may be an implant, whether there's an implant in a treatment plan or not, because I believe that's pretty much the standard of care. How to manage the soft tissue, how to get the hard tissue out, the teeth, how to sedate that patient during that, the recommended protocol for medications, for pain and infection, complications, all these things. So my course is a 2-day course, but that's what I probably meant when I said if you had to borrow, then borrow for whoever you're taking, because that's going to be the quickest way to change. Now, we are spending early time right now on talking about your skill sets required for the dream practice, the practice of your dreams. And what is that? Where you go in and you're not feeling sorry for yourself because you have these vast openings in your schedule. And you're really not that worried about ancillary skills at this point, including whitening patients and things. And I hope I don't get hate mail on this, or even sleep disorder, because if you have a fundamental, which we got to get to in several podcasts, if you have a fundamental examination and case presentation protocols. And that means a lot of stuff. Who's coming to that visit? How do you decide what to recommend when? I mean, there's so much to talk about. If you have that, you're going to find yourself in an arena that I'm in where you really don't have so much time or even desire to augment those type of skills into your practice, because you're basically functioning doing tremendous tremendous periodontal / surgical skills that combined lead to really healthy dentitions. The biggest thing, of course, that we cannot overlook and we have to spend time with is treatment planning decisions. Like, what can you segment? What can you prioritize and get to something later if that's possible? That's a big part of what we have to talk about. So again, I know I'm going in a little different direction for you, because after spending several podcasts with Corona advice, which we can do privately if you want, I want to get you back to what it takes to have this practice you hear about with me each week and maybe some of your colleagues, because I know how to get you there. And that's what the point of this is. Have a great week. I hope this helped a couple of you. I'll look forward to you next week on the Lionhearted Dentist. Thanks for tuning in.